right, here we go. Ready? Start.
Sink clap, baby.
Doc, do I need this? Do I really need this? This is one of the most common questions I get as a dentist. Here's the thing. I can't actually answer this question for you. What? You're the doctor. Why don't you know? Why don't you know? Because ultimately, very little in dentistry is necessary. What are you talking about? Have some pride in your profession. You think you do something that doesn't matter? No, I think it matters a lot. I'm mildly obsessed with taking care of my teeth. My teeth are very, very valuable to me. I consider them worth their weight in gold. Honestly, probably more than that. Very, very valuable, very important to me, my teeth. I'm very strategic about protecting my teeth and keeping them healthy. I plan on keeping them in tip-top shape for my entire life. But that doesn't mean they are important to everyone else. Lots of people don't value their teeth that much. They don't think they're very valuable. Or maybe they are unaware of all the things that could be going wrong with their teeth until it's too late, right? Maybe they would consider them important if they had a better picture of what was actually going on. Most of the time, letting your teeth fall apart isn't going to kill you, right? It can in rare circumstances, but it's pretty unlikely. So when you ask the question, do I need this, right? Do I need this? My answer requires that I have more information from you, about you, right? Do you value your teeth? If you do, I can tell you how to protect them, repair them, and keep them for a lifetime. If you don't, then who cares? Live your best life. What do you need me for? Here's why I think teeth are valuable. Feel free to disagree. Teeth make us look pretty. Teeth help us chew food. Teeth help you speak and communicate with others. Healthy teeth keep us out of pain. Those are the big four. If you value those four things and all the rights and privileges that go along with them, then congratulations, you value your teeth. Teeth make your social life easier, right? It's easier to have dinner with friends and family when you have teeth. It's easier to go on a date when you have teeth. It's easier to feel comfortable at work when you have teeth. Also, there's more in your mouth than just teeth, but I don't want to overcomplicate things here in this short little video. You got other junk in your mouth besides teeth to take care of. So, when you ask your dentist whether or not you need a treatment, maybe you're asking whether you need this for function or for looks. Just say that. Just say, is this needed for health or is it just cosmetic? That's a better, more specific question. There are a lot of things in dentistry that improve function and cosmetics at the same time, but there are some things that are just cosmetic. By function, I'm basically referring to your ability to eat and speak. Any competent dentist will be able to make that distinction for you. The second part of the do I need this question is, do I need this right now, right? Again, I can't answer this question for you. I can give you the pros and cons of treating your problem if you're willing to agree with me that you have a problem, but I cannot predict your future for you. I can lay out some vague probabilities, but I've been wrong before, just like every other dentist and doctor on the planet. Do you know any person in any profession who can accurately predict the future consistently? The world is a complex place. There are lots of variables that change all of the time. I can give probabilities, but there are no guarantees. If you have cavities developing, I can say you might develop a toothache or lose a tooth at some point. When will that happen? Hard to say. Depends on the size of the cavities, depends on your eating patterns on a daily basis, what you're eating, how you're eating it, depends on your brushing and flossing technique and frequency. Now, a discussion between the two of us can narrow down those probabilities and give you a better idea of your likely risk, but again, no guarantees. If you lose a tooth and neglect to replace it, you may be more likely to lose other teeth due to decreased chewing surface in your mouth, right? You lost a tooth, you have less to chew with, and that means increased pressure on the remaining teeth. If you have a ginormous filling on a tooth and there are cracks running through the tooth, and you choose not to put a crown on it, right? Crown, that's like a protective hard hat for a tooth with a giant filling or a fracture. You might fracture that tooth further and you may have to have it pulled. I understand patients want to know, is this necessary? How much will it cost? How long will it take? Is it going to hurt? Right? These are the pressing questions you want to know about every dental condition. And all of the answers to those questions can vary substantially from one individual to the next. And patients often don't know anything about dentistry or dental health, so I'm often starting from zero when I try to explain this stuff. Also, we might not have the optimal amount of time for me to explain and for you to ask questions in a dental office. None of that is your fault, right? I'm sure you're a stellar person. There's no reason for you to know anything about dentistry. Why would you care until it matters to you, right? But that's what this YouTube channel is for. Helping people understand dentistry so they can make more informed choices about what they need and want when it comes to their dental health and smile. The overarching point I'm trying to make, everyone has different value systems and priorities in life. Our solution in Western democracies with civil rights and individual liberties is to give people free rein to decide for themselves what they think is important, right? We don't have a dentistry czar who tells you what is best for your mouth and forces you to do that thing. Healthcare is tricky though, because it's harder for the average person to understand. We try to give you individual responsibility to take care of yourself and make healthcare decisions for yourself, but maybe you don't know exactly how to do that. That's why we want healthy, honest, transparent, collaborative partnerships between healthcare providers and individual patients. So watch the videos, ask questions. I want to figure out what you want, or at least help you figure out what you want. What do you want out of life? What do you want? Huh? What do you want? Stop drifting through life like a plastic bag, drifting through the wind, waiting. Stop waiting, okay? Make some decisions for yourself. Then I'll try to guide you toward realistic solutions to the dental problems you agree that you have. I can't decide what you consider to be your problems. I can't decide what you consider to be your needs. It's outside my purview as a healthcare provider. However, I might be able to assist you in making a more informed decision about what those priorities are for you. All right, thanks for watching. Please like, subscribe. This week, all subscriptions go directly toward the unauthorized sweatshop labor of dandelions in Tunisia. Our corporation is very abusive of dandelions. We work them all hours of the day and night to bring you these videos on the cheap. Please like and subscribe. It's very important that we meet our dandelion abuse quota. Be like Katy Perry, shoot some fireworks out of your torso at a bunch of dandelions in Tunisia. Set those dandelions on fire. Thank you. I don't know if you guys have ever watched the music video for Katy Perry's Firework, but it's pretty wild. It's all about, being your best self, not hiding who you are, pushing through struggles to realize your dreams. After every hurricane comes a rainbow. It's a bunch of cutscenes of people in anxiety-inducing situations or scary situations, overcoming it in some way. One of them is a dude. He's about to get mugged by 3 dudes, and when they push him up against the wall, doves fly out of his jacket, and he starts doing card tricks, so they stop mugging him. I don't think that's how that would go down. Oh, this dude's a magician? We probably shouldn't mug him anymore. No, it'd be more like, this dude's a magician? Let's mug him harder. It's funny because when you kick him in the nuts, a rabbit crawls out of his butt. There's no way being a magician saves you in that scenario, right? You're getting it worse. Also, one of the little mini stories in the music video is a bald kid in a hospital. I think we're supposed to assume he has cancer. I might be reading into it, but I think that's what's supposed to be implied. And this poor kid is walking around the hospital and he looks in a room and he sees a woman giving birth and there's fireworks shooting out of the woman, like there are fireworks shooting out of Katy Perry. And I get it, the message is, one person dies, another is born, hurricane, rainbow. But also, harsh thing to be saying to a kid with cancer, Hey, sucks you're gonna die, but at least this other kid is gonna be born and will probably have a rad life, Ouch, a little salt in the wound. You couldn't show the bald kid shredding on a skateboard, before he croaks. He just has to find hope in the person replacing him. Harsh, Of course, existentially, that is what happens with all of us, right? That's the whole deal with being a parent, training your kids to replace you. But this kid was 11, and was dying, right? Is it really on him to have that level of psychological existential maturity? Katy Perry? Crazy music video. Anyway, take care of your teeth. By demonstrating and modeling healthy actions, we can teach the next generation to take care of their teeth through imitation of us. And then we are replacing ourselves with better versions of ourselves, which should be the goal, right? Ideal world, that's what we should be doing. I don't know, that's kind of what's so annoying with baby boomers, you know? It's almost like they want us big, dumb, stupid, terrible, lazy millennials to fail. It's like they're rooting for us to be worse, you know? That's really sad. You shouldn't be rooting for the failure of the generation behind you. It's pretty selfish, you know? Unless you're like 11 years old and have cancer, you know, then it's understandable for you to have that kind of a childish response because you're a child. But if you're older than 25 and you're yelling at people younger than you instead of modeling a better way to live, grow up. Let's get down to business to defeat the Huns. That's not Katy Perry, that's Mulan. Moulin Rouge. All right, shut up. What am I saying? All right, shut up. What am I saying? Come on, quit it. All right, let's get down to business.